The bony orbit is complex, but we'll try to simplify it. The bony orbit is the bony cavity in the skull that houses the globe of the eye, that's the eyeball, the muscles that move the eye, that's the extraocular muscles, the lacrimal gland, and the various blood vessels and nerves. We can anatomically structure the orbits as a pyramid with a wide anterior base and a posterior apex, a roof and a floor, a medial and a lateral wall. It is interesting to note that the two medial walls of the two orbits are parallel to each other, and the two lateral walls create a perpendicular segment. And as such, the line joining the anterior base and the posterior apex forms the orbital axis. So we have cleared the introduction part of the bony orbit. Now what we will try to do is to create a two-dimensional representation of the bony orbit and then cut and fold it into a three-dimensional structure which it is. We'll of course talk about firstly about the apex, which is directed backwards posteriorly. The bony orbit through its apex has several fissures and foramen. We'll first see the superior orbital fissure, followed by a more medially optic canal and the inferior orbital fissure. The lines which I demarcated before form the major bone of the apex, which is the sphenoid bone. The sphenoid bone is comprised of the lesser wing, the greater wing, and the body. Moving on to the medial wall, it's slightly complicated. There are three structural bones forming the medial wall. It also lodges the lacrimal gland, and hence that lodge is termed as the lacrimal groove. From the posterior aspect, it's the ethmoidal bone E, lacrimal bone L, and the maxilla. Moving on to the floor by simple imagination can be demarcated by the formation of palate, that is the palatine bone and the maxilla. The roof is formed by the lesser wing of sphenoid and the frontal bone. And lastly, the lateral wall is formed by the greater wing of sphenoid and the zygomatic bone. However, this part is actually the frontal process of the zygomatic bone, and the actual zygomatic bone forms a small area of the floor. We have the superior orbital fissure, inferior orbital fissure, and the optic canal as such. The lacrimal groove lodging between the lacrimal bone and the maxilla. And of course, the infraorbital fissure or the infraorbital canal, followed by the lacrimal bone, posterior and anterior ethmoidal foramen. Now let's talk about the contents of the foramina. The three major foramina are the optic canal, superior orbital fissure, and the inferior orbital fissure. The optic canal consists of the optic nerve, that is second cranial nerve, the ophthalmic artery, which is a branch of the internal carotid artery, and the sympathetic chains. Moving to the superior orbital fissure, we have the superior and inferior ophthalmic vein moving through it, the C3, C4, C5 and C6 nerves. However, the C5, that's a trigeminal nerve, has a special unique segment termed the C5-1, only carries the sensory impulses, which involves the nasociliary, lacrimal and frontal nerves. And lastly, the inferior orbital fissure, which as the name suggests, comprises the infraorbital nerves and vessels and the zygomatic nerves and vessels. So now it's just a quick recap. The roof by the frontal bone and the lesser wing of sphenoid, the sphenoid bone and the greater wing of sphenoid with the zygomatic bone forming the lateral wall. Zygomatic bone, the palatine and the maxilla forming the floor. the maxilla, lacrimal bone, and the ethmoidal bone forming the medial wall. Cut the white excess and paste the remaining colored segment and you get your orbit. Thanks for watching.